Good afternoon, dear patients. Today we will discuss a case of white bumps on the foreskin. A young man came to us who had undergone circumcision about a year and a half ago. And accordingly, against the background of this slight redness of the foreskin, which you can see in the picture, there are these small raised white nodules, this is the correct medical term, that are directly bothering the patient. How? Well, first of all, by their appearance. It is indeed noticeable. At a young age, people are embarrassed by any, so to speak, striking differences from their peers, especially when it comes to early sexual experiences. Secondly, according to him, they are bothersome because of their location here and, well, they interfere with friction during sexual intercourse and during masturbation. And accordingly, he would naturally like to have some diagnostics and get rid of these things. We examined him taking into account that he is already sexually active. We took samples from the surface of these eruptions, from inside the urethra and from the glans penis, to test for sexually transmitted infections. We also examined similar eruptions using a dermatoscope. It is very important here to rule out Molluscum contagiosum. You can watch a separate video on our channel to learn what Molluscum contagiosum is. Generally, it can present as small nodules on the foreskin. In some cases, we even perform a histological examination to determine whether it is truly Molluscum contagiosum or not. But in this case, it was not necessary. And in general, it is also important to rule out a condition such as Lichen Nitidus. In my practice, I have seen it about 10 to 12 times, probably over the years. But as a rule, if it is localized on the genitals, most often it appears on the glands and usually occurs independently of circumcision. These are small nodules. You can watch a separate video on our channel to learn more about Lichen Nitidus. So essentially these two diseases were ruled out. And in principle, these are still sebaceous glands that in general became apparent after circumcision. This is possible in a more pronounced way. And naturally, after the completion of puberty, I also periodically see in my practice that the sebaceous glands increase in size. Well, regarding the test, Candida albicans was detected, that is, a yeast infection was found despite the absence of symptoms. In this case, it needs to be eliminated because it may be partially responsible for this redness, yes. And such therapy was carried out. You can also watch a separate video on our channel about the treatment of Candidiasis in men, so we won't dwell on it now. Well, and such glands are removed quite effectively by methods like the radio wave technique and somewhat less effectively due to greater scarring by laser or electrocoagulation. People often ask me, does it hurt? No, actually it doesn't hurt at all. With modern creams, it's possible to achieve quite good anesthesia. As a rule, the patient hardly feels the removal at all, considering the shallow depth. Do scars form after this removal? Well, that all depends here on the doctor's experience. If the doctor has experience removing such sebaceous glands, then scars do not form. Indeed, lighter spots may appear due to initial, very superficial scarring, but they disappear over time. Do these sebaceous glands grow back after removal? If the sebaceous glands are completely removed, as a rule, they do not grow back. I do this quite often myself, and accordingly I do not observe regrowth. The only thing is, of course, that it's sometimes difficult to determine the depth of removal, and some glands are not removed the first time, because to avoid scarring, you naturally need to remove them superficially. In such cases, we remove the remaining individual glands later, let's say, after the surface has completely reepithelialized. As a rule, this happens no sooner than 1.5 to 2 months later. Therefore, in this case, these are the sebaceous glands of the foreskin that became apparent during puberty and after circumcision, and which can be successfully removed. And accordingly, as I mentioned, a concurrent case of Candidiasis was also found, which was treated before such removal.